Okay, it's 9 o'clock. Today is Tuesday, February 9th, 2021. We'll call the meeting to order. Please stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, minutes and reports received and filed.
The Treasurer's January 2021 reconciliation report was received and filed.
Okay. Commissioner Committee liaison reports, upcoming meetings.
Let's see, today we got that press briefing announcing the new stations at Wardsville and over at Cole County. 2 o'clock at Wardsville, 4 o'clock got a Home Builders Association board meeting, got a planning commission meeting tonight at 5:15. Solid Waste Management District Board meeting tomorrow at 1. HBA meeting Thursday night, or Wednesday night. Chiefs meeting Thursday. Where's that one at, Sheriff?
It'll be at the Monticello, Cole County Fire Protection District.
And then I've got Renegades Coffee Friday morning if they're doing that again, so.
How are we?
I think that's about it. I got Heartball. It's usually the 13th. Are they doing anything with that?
It's a virtual, you can go on there and bid. Wear your tuxedo though, so that, you know,
All right.
Yeah.
Just the top, right?
yeah.
Oh,
Now, next time you see me in a virtual meeting, just try to get that out of your head.
I'll attend those EMS events this afternoon along with Jeff, and tomorrow is a Salute to America meeting I'll attend.
Okay. I've got a meeting today with Christy with the schools at 1:30. Tomorrow I've got a meeting with Christy with Senator Branstadter. Tomorrow is also Carolyn McDowell's birthday. Thursday we do our press WebEx at 1. And then Monday, even though it's a holiday, we're going to do our partners WebEx on healthcare. So that's all I've got. Appointments by commission. Appointment of Jason Branstadter to the Heartland Port Authority Board of Commissioners. Jason, you want to come on up and...
speech.
So do you want him to explain who he is before we approve him?
Well, I think we'll have to do our due diligence first, but I think he's likely to get the votes, but we'll let him. Jason, it's great to have you here. It's great for you to agree to this appointment. So, but I think maybe the folks in the room and those watching would like to know a little more about your background and history, and go for that.
Well, my name's Jason Branstadter. I work for Capital Sand Company here in Jefferson City. I've been with them for 23 years in various capacities over the years. Currently, I'm the operations manager for all of our locations around the state of Missouri. I did grow up in California, Missouri, so Central Missouri person.
Oh, no, wait a minute. We could stop right now in California.
So I won't hold the Blair Oaks Falcons against you.
No, I'm just teasing. Appreciate it.
Touche.
But lived in Jefferson City after I got out of college, so I've been in the Jefferson City area for quite a few years now. So very familiar with the Missouri River, with working for the sand company over the years. Been involved with inland rivers, ports, and terminals. I'm involved with the Missouri River Dredgers Group, the group of all the dredgers that have permits on the Missouri River, as we work through permitting cycles and issues with that. I've dealt with MoDOT over the years in the material side of things for highway projects, but just had quite a few experiences with the river and moving freight up and down the river and just the issues that come along with being on the river, whether it's high water, low water. Right now we have ice flowing down the river today, and that's only going to get worse here over the next few days. So but just feel like I can bring some good experience to the Port Authority Board.
I agree.
Yeah, good background, so appreciate you.
Right, Jason, you bring a unique set of experiences to serve on the Port Authority. So I'd like to make a motion to appoint Jason Branstadter to the Heartland Port Authority Board of Commissioners, a term expiring 12/31/23.
Second.
All in favor?
Aye.
Welcome aboard.
Thanks
Thank
again,
you.
Jason, appreciate it.
And I still was trying to save 55 cents, but we'll spend it. You're worth that. Thank you. Thank you very much.
Thank you.
You're welcome to stay for any or all the part of the meeting, or if you've got to get out there and work on that ice, we understand that too.
I think I will excuse myself. Thank you.
Thank you, Jason.
Appreciate it.
Okay, any commission comments?
Smart man.
Bids and contracts, sole source ad approval, Axon Enterprises.
We just need approval to run the sole source ad for Axion Enterprises. It does the tasers and their accessories for the sheriff's department.
I'm good. Make a motion, we approve the sole source ad for Axon Enterprises.
Second.
All in favor?
Aye.
Aye. Approval and signing of WIC reminder service agreement.
Right on time.
Good morning.
Good morning.
So this is just a service for WIC that would send out like text reminders for appointments. It helps with the no-show rate, tries to get people reminders about their appointments. I guess a lot of other WIC agencies are using it because it interfaces directly with the MOWINS system that is the state system that all the WIC appointments go into. So it reminds me of them of their appointment, and it reminds them what documentation they need to bring along, because that's always an issue if they get to the office and they don't have the kid with them that has to be weighed and measured, or hemoglobin, or they don't have their proof of income. It makes for grouchy clients when they come in and they can't get their benefits because they don't have the right documentation with them. So this service will help. Melinda already got it approved through the WIC contract to be reimbursed, so the money's already in our contract to pay for it. This is just the agreement to have it done.
Motion to approve and sign the WIC reminder service agreement.
Second.
All in favor?
Aye.
Aye. Boy, you're good, Christie. Signing of agreement with Soil and Water for 2021.
Okay, this is the annual soil and water that you guys budgeted. This was Christie's signing. So, Jill has looked at it, and it is for $5,000. So we need that signed in order to make that payment that's behind it.
We'll all sign that. Yeah.
Motion to sign the court order for the agreement with
I think it's soil and water conservation.
the Soil and Water Conservation District.
Second.
All in favor?
Aye.
Aye. Okay, signing of Salute to America agreement for 2021.
Again, this is in the budget for 2021. It was $5,000 set aside for the Salute to America, and that's the agreement in order to get them paid this year. And Jill has looked it
We'll
over.
switch out.
Actually, Jill created it.
Make a motion, we sign the agreement with Salute to America Foundation.
Second.
All in favor?
Aye.
Aye. Do we have any unfinished business?
We don't have anything new for CARES today, but is someone checking with the courts on their covering?
We were looking at some stuff last week and I don't know, heard anything. Greg came up with another idea as far as maybe using bus shelters there, and I think that's a great idea.
I did too.
So,
And I talked to Mark Mamert yesterday with the city transit and he sent us over, like 5 or 6 different companies that we can, but it would be like kind of like the bus shelters that you see, and nobody wants to do any kind of a tent or a carport over there because they worry about the liability. That wind that comes up that way is, so I said, well, let's just buy the carport and put it up ourselves
I think we
and
can
embed
find
it in
somebody to
concrete,
put a
but
carport over there.
yeah.
I don't know who's worried about the liability. They put these things up all the time. So you're just gonna have to have it anchored down and find
Yeah.
somebody that wants to do it, and that's not a level surface. So we're
No.
gonna determine if we wanna put piers in there, cut legs off and stuff like that, but the bus shelter is probably gonna be the easiest thing and something that's gonna be reusable. I think it's a lot cheaper. If you Google them, you can find them for under $1,000 for a 10-foot shelter. So if that's the route we wanna go, I didn't hear anything back after our other emails last week. I know you sent something about you talked with Mayor, but
Yeah, and it had.
I'm betting those are more around 5,000 apiece.
Oh, you think the city would,
I'm just saying those are probably a little nicer than the ones that I found for 1,000.
yeah,
What were y'all planning on putting in?
Going in the entrance of the courthouse, just something to help for
Shield them.
cover for
I
new
just get a
weather.
picture in my head where you're talking about, but
along
gotta do something.
along the sidewalks, near the entrance there.
In the grass.
Greg was saying probably put it on the sidewalk, but I said, boy, you gotta be able to get like a gurney or something, if EMS or,
Well, that's pretty wide there.
yeah,
As long as, they know, Greg knows the
Yeah.
distance for ACA, make
Yeah.
sure a wheelchair can get by there.
Yeah, I think.
well, he
it'll
said
play
it's not the ADA accessible entrance.
I'm talking about jail stuff, I'm here, I'm making notes of
Yeah.
jail stuff, that's ACA.
He said that's not an ADA entrance, so that wouldn't, and I'm like, no, I think we still need to. But anyway, yeah, we're still.
Kristen, the short answer to your question is anybody looking at this? The
Yes.
answer is yes.
Yes,
I just want to make sure we're moving forward because we're trying to get that CARES money spent, and we want to make sure
Right.
we have something set aside for that if that's a project you guys want to do.
It'll be interesting. It may well be the bus kind of shelter, although there might be people standing there waiting for the bus. So we have to be careful about that. And actually, those shelters don't do much for the wind if the wind's coming in a certain direction. So, details will have to be worked out, but that may be the answer.
Okay.
Donnie did stop by yesterday and was talking about the heater in the basement floor of the courthouse because when they have that door open, so that's all I know. He talked to me yesterday.
yeah, Greg
Portable
talked,
heater.
Greg talked to me about that too, so. Okay. Any other unfinished business? New business, accounts payable review.
I'd ask for approval of accounts payable pending review.
Go ahead.
Motion to approve accounts payable pending review.
Second.
All in favor?
Aye.
Discussion of support for the state track meet. We had signed an agreement, I think, in order for Jefferson City CVB to get the state track meet here. We said we would pay up to $5,000 in EMS cost to have ambulances there. And
It's in kind.
yeah, in kind. And of course, last year it was canceled. The year before that, it was canceled because of a tornado. So, but I think, state track meet brings people into Jeff City like nothing else. They fill our hotels and they eat out and everything. So, I think you had talked to Diane about continuing it since we.
Yeah, they talked to EMS and about it, and so Matt brought it to us, and I didn't remember exactly what the agreement was, so we revisited it, and I'm good with it. I think
Yeah.
we bring the track meet, keep the track meet here, and partner with CVB to get it done, so.
I agree.
I agree.
I don't know if we have an agreement or anything that we are
I
signing, or.
couldn't find anything in my files.
I'll talk to Diane and see if.
I remember us talking about this before.
Yeah, we agreed, I think, for 5 years, if I'm not mistaken. because I think that's what the contract was a 5-year contract, but I will,
I don't even know if we actually signed it.
okay, I will talk to Diane.
I think we just maybe voted to do it. I don't know, I don't have in my electronic.
I know we approved, because I sent a letter that we submitted to Misha to, when we were bidding to get the state track meet here. So I sent a letter on behalf of the Cole County Commission in support of it, and
Stating you would provide.
yes,
Okay, so that's what it was, rather than an agreement between parties.
Yeah.
Maybe, is an MOU in order that
I mean,
would document what,
It would hurt.
okay. Why don't we reduce it to writing so that a year from now we'll know what we did and we can repeat it and just change the
We
dates?
just need to decide who it should be between.
yeah.
Okay, the parties. Well, you're going to check with,
I will check with Diane and see if there is some kind of a contract that we,
they may have a contract with Misha
Yeah.
of some kind.
And
So,
then we could have it with the CBB, that we'll be providing $5,000 of the in-kind contribution of EMS services.
yes,
fair
Okay.
enough.
It might have been in 17 when we did that.
it was.
I can't find it.
It
I know they had
was.
to have a letter of support or something, because they had to include it with their proposal that they did for us to post it, so there should be something out there. I thought they emailed something to us about that, but I'm not finding it,
Yeah.
so.
We submitted the letter in 17 when we were bidding, and I think it was for 18, 19, 20, 21, 22. But then,
I can kind of.
They didn't have it. They didn't- pardon?
I can structure it similar to the salute agreement.
Yeah, that'd be good.
Something simple like
Okay.
that.
Okay,
But talk to her.
yeah,
And
I
if
will.
necessary, have her call me.
I will do that.
Okay, thanks.
Do we need to make a motion to?
Just get the agreement, once we have the agreement.
Okay, okay,
I think we're in agreement that we're going to
do it, yeah.
do it, it's just.
Okay, I will
If
do
find
that.
something, I'll let you know, Joe. I thought we had something.
Yeah, and I can
I've got a-
look in my files, see if
Yeah,
I can find
because
something.
I looked at my electronic folders, which is normally where I would have all that. and couldn't find it.
I got too much stuff filed under miscellaneous.
Okay. Sign of surplus title. Boy, I do this a lot.
Well, I actually have two of them. Oh, no, I messed up. One is the health department vehicle that was still damaged in the hail that we need to, they finally determined it was a total loss. And the other one is the sheriff's department, and they're gonna sell their van on Blue something. Blue Wave. Purple? Okay, one of those.
Well, since it's law enforcement, it's blue way for us.
There you go.
These
Thanks.
separate motions?
Yeah, I think so.
Motion to sign the certificate of title on the vehicle owned by Cole County Public Health.
Second.
All in favor?
Aye. Motion to sign the certificate of title on the Cole County Sheriff's Department vehicle.
Second.
All in favor?
Aye.
That first one wasn't the health, though, it was.
It was.
Was it the health one? Okay.
It's been in limbo for a while.
Okay, okay. 911 center upgrades. Sheriff,
So these are the upgrades that JCPD did in the 911 center. And our contribution right now is $73,667 with an additional $13,000 left in 2021 for ongoing projects. I went down and talked with them. This was CAD upgrade hardware and then CAD software because they went to enterprise versus a server. And then the last one was the 911 to text to 911, and that would be for countywide for all citizens in case they're deaf or hearing impaired, whatever, they can text 911 if they need assistance. The software's in place, the hardware's in place, they're just waiting back from the FCC to get permission to utilize the lines for that. The radio tower was the last topic on here. It was $11,800, but we do use JCPD 1 and JCPD 3 whenever we lose our net for if it's held for an alarm or if it goes down for some reason. Our policy is to switch over to JCPD 3. So I agree with all of these and would ask that we spend the 73,667, and then the additional 13 would come out of contingency to pay that. We did talk to them, and I expressed some concerns over maybe better communication between us in reference to if they have any further upgrades. The Chief Schrader and I spoke, and I don't think that's not going to be an issue anymore. So I think it's a good thing. It helps everybody. So.
Yeah, I think that was just a concern was when we agreed to it or what, so like in the future going forward, if they can let us know a little more
Yeah,
ahead of time and go from there.
yeah. But we're being the Bank of Cole County, we're.
How do you guys want to pay for that? We currently split the 911 cost 75-25. Do you want to do that same thing with these costs? So 75-25 between our EMS sales tax and the law enforcement fund.
Does this benefit EMS?
No, they don't use the CAD. They're the only ones that don't use the CAD, and they don't ever use JCBD 1, JCBD 3. And probably, and I hate to say this, probably all that needs to come out of law enforcement fund.
Okay.
Unless, you guys just want to make it pay for half, which I'm good. I don't have a problem if they pay it all. I'm good with that. As a matter of fact, he just sent me a text. Yeah, he says they'll pay it all.
They'll pay it all?
Can we see the text, please?
Mine erases immediately afterwards.
Oh, is that's one of Governor Wrighton's phones? Okay. Okay.
Probably the CAD, I mean, they do record the information down in CAD, so there might be some connectivity, but I don't know, probably you're better off just taking all that money.
I'm fine with it.
Motion to approve the 73,667 CAD upgrade plus
The
13,000.
Yeah. Let's hold off on the 13. Let's just do the 76 because they said possible. So I don't know if they'll complete those upgrades in 2021. So we can come back for that other 13,000 if you would like.
Okay, the restated motion is to approve the 73,667 CAD upgrade with the Jefferson City Police Department.
Second, and that's work that's already been done.
Yes.
Well, some of it's in progress. Like I said, the text and 911 is still in progress, and there's still some upgrades going on with the enterprise. Whenever you change a CAD system, you can't do it within 3 months or 4 months. It's a long process.
So John will be getting us a transfer out of his contingency
Yes.
into capital.
As soon as I get back, well.
Into 911.
Into 911,
Oh, you want to
Yeah.
go to 911? Okay.
yeah.
Okay.
So I've changed the motion, but restated one more time, approve the 9/11 center upgrades for CAD with the Jefferson City Police Department, the amount of 73,667.
Okay, second.
All in favor?
Aye.
Aye.
Thank you.
Okay, first reading of budget adjustment number 1.
Yes. This is for $128,480. This is a grant with the health department, and this is vaccines. You know which one this is?
Regional, it's our regional implementation.
No action today. We'll bring it up in 10 days to actually change the budget.
Okay. Discussion, approval of part-time position for PR health education.
So we briefly talked about this Thursday, and then
Yes.
I asked that Christie kind of make a proposal on 2 or 3 months and throw it together.
I'm sorry, between Thursday afternoon and Friday and yesterday being full of calls, this is like
Well, I'm gonna take
formal
that away.
proposal. I didn't really have time to get
Take it
anything
away.
formal together. So, but basically we had talked, we had had the bucket media for a while, and it was really, some of the planning and the timing with that didn't work out, and we talked about having, other health education things, whether social media or press releases, or having someone listen to our press briefings and get the information out that we needed. And there was some other discussion about having Bucket do that. Well, I happen to have a part-time staff member who was doing contact tracing, and now she's doing scheduling for us, who has a degree in health education. So I would like to just have her work as basically a health educator, and I think it'd be really beneficial because she could be there doing scheduling or other things, and then I could go to her and say, hey, I need a social media post that says this, and she would do it right down the hall. She understands COVID because she did the contact tracing. She has the background, and she actually had proofread some of our press releases in the past to just increase their readability, because that's what she does. So I think having her do that for 3 to 6 months would be really helpful.
It
As we
changes.
work-
I mean, it's like yesterday,
I know, we probably
the
need-
governor's,
We probably need to have a discussion after this about vaccine distribution. I have a letter I wanted you guys to see, but I think having this person do some health education would help out a lot.
yeah, we need to just get it out there, but every week it changes.
Right.
Sometimes it's not even in a week.
Right, and that's why having her right there in the health department, we don't have to go anywhere. I don't have to call any, I can just say, I need you, can you do this for us? So,
Do you have any idea dollar amount?
I think 20 hours a week, and that's what she was working. I think as a schedule, we were paying her 18. I would say as a health educator, we could probably do 18 or 20, maybe just up it to $20 an hour. She had been at a contact tracer, we paid them 25. But anyway, I jotted down some, duties of assist with press releases, listen to the press briefings and summarize the info, distribute to press, draft social media posts, and respond to media inquiries, because sometimes we'll get 4 in a day, just a whole laundry list of questions they want to answer, and it's very time consuming. So 20 hours a week.
For a couple months, or?
Like I said, I think 3 to 6 months.
Do we ever run into concern about somebody tipping over to the 6-month plus and ending up being benefited, or is that an issue to even worry about?
If you keep the 20 hours, we're okay.
Oh, okay, right.
Yeah, if they get more than that.
They would never get 1,000 hours this way.
Right, and most of them, the 1,000 hours is with surf, 1,500 with loggers, so, and that's in a calendar year, so if they're already gone by the time that happens, then it's not, they don't go back. So if they're currently an employee, they'll go back and try to pick them up, if they go over that amount.
1,000 for
Surf,
Calendar.
1,500 for our loggers. What is it for our own health coverage?
it's the 30 hours a week.
30 hours a week.
As long
Got
as you
it.
keep her at
Okay.
20, she's
Yeah.
fine.
Yeah,
All right.
She
Good.
doesn't want a full-time job, part-time is what she wants right now, so
good.
it works out good
Yeah,
for us. Okay, so we can do that. You okay with that? $20 now?
yeah.
So I have to fill out another pay form for her. It's, Jody. Okay. Thank you.
Thanks.
Thanks, Christie. Mid-Missouri Regional Planning Commission Support Letter.
I thought we did that last week.
I thought you did as well.
Oh, what's on the agenda?
We did it last week.
Mid-Missouri Regional Planning Commission Support Letter.
Yeah, you did do that.
Oh, okay, never mind.
I don't know what.
Okay, hey, we're done. Do we have any other issues to come before us?
So David
Oh.
sent that email, and I think he just needed a letter, which we already approved. Or
Yeah,
y'all approved to pay that for that loan program. So we just need to get a letter thrown together.
We had a letter, right? Is that the one that you sent me and then I mailed off? Was that?
Yeah, so you guys signed the letter last week
Yes.
on letterhead. It should have been mailed.
okay, okay,
So it was all done.
okay.
Yeah. Remember that?
You, children,
Okay, you guys.
Could you call security?
Yeah, Johnny threatened to snap that.
This is an antique.
I'll get you a copy of that, but I'm sure we do.
See this, Christie, with Cole County Bank?
Oh, yeah. Bank of
And we're
Cook County.
paying-
That's what we are now? The Cook County?
Debbie is paying 4% on savings accounts.
Debbie.
We'll look with the treasurer over there.
Yeah. Do you guys want to talk about vaccine a little?
Yes,
bit?
please.
Okay. So I also received another letter, which I'll give to you, praising the efforts at the link last Friday. We received very, very positive comments about the organization of the event. We had 72 people scheduled every 15 minutes, and people did really come in waves. They would come in, we would make sure their paperwork was filled out. If they didn't bring it with them, they would sit at the table and fill it out. They got their temperature checked because they didn't want to give anybody a shot that had a temperature. They would go into kind of a holding area, 12 in each one. There's 12 rows of 12. As the first row is empty, they would sit down, and then I guess that was east, north, south. The nurses would go east, west, give 2 people at a time their shot. So the whole first row, would wait their 15 minutes. They had it up on the scoreboard at the link so they could watch their time. As their 15 minutes up, they would exit out, and then the next row would fill in. It worked very, very well. We had 15 Lincoln nursing students there, and thank goodness we did, because they got there at 6 a.m. and they started putting all the stickers on the cards. They started opening syringes. They helped draw up the vaccine. It takes a lot of volunteers to have an event like that. The National Guard got there about 6:45, and they mostly directed traffic outside. We had a couple greeters at the door, and then they also did data entry. So it was a long day, but a lot of positive comments, and we gave over 2,000 vaccines. So we will do that again. It'll be like Groundhog Day on February 26th for the second doses. Central Bank, did all the calling for us because DHSS announced yesterday that new Missouri Vaccinator software where people can go register for mass events like that, but it wasn't ready yet. So we had Central Bank call people off our list of 6,000 and schedule appointments. So we're talking about having them call and give them a reminder, because they do have to bring that consent form again. And I'm sure a lot of people think, well, I filled it out the first time, I don't have to do it again, but you have to give consent for us to give you the second dose as well. So we'll probably work with Central to call and give reminders. There was about 50 doses at the end, and everybody had their list and they started calling. So at the end of the day, there was 2 doses, and St. Mary's took them back because they had somebody at St. Mary's to give them to. So not a single dose was wasted.
Good.
There was 40 vials left over that were not mixed up, and we brought those back to the health department to give. We had clinics this week scheduled with Department of Corrections, and it's a good thing we did because we didn't get any vaccine again this week, and we won't be getting any more Pfizer. The state has changed their distribution plan, so they have those high throughput centers that they announced. So like this week, Cap Region and St. Mary's get 2,000 doses. Next week, MU Healthcare gets 4,000. That will be the rotation. And then for all the local public health agencies in Region F, which there's 13 of us, we get 600 doses a week. So we started talking this, and that's Moderna. So we started talking this morning about how between the 13 of us, we're gonna divvy up 600 doses a week. I said, it's like, our call was at 7 this morning. I'm like, it's like trying to divide a pack of M&Ms between the whole class. But some of the LPHAs have second dose clinics scheduled, and for them, the small health departments, that's all they can do. So they don't need any first doses for a while until they get through their second doses. So this is just new first doses every week. So
We have enough Pfizer for second doses?
the second doses are guaranteed,
Okay,
but we're not,
okay,
and right
okay.
now, we're not really scheduling much, so. I told my staff the good news is we're not gonna kill ourselves doing 750 vaccines a week, because we won't have the vaccine. We're probably gonna try to ask for about 100 doses a week, but, we need to be fair to the other LPHAs in Region F, so if we only have 100 doses a week, we'll just give 100 doses a week. That's all we can do. Can't give it if we don't have it.
Well, our
So-
hospitals will, and JCMG will do,
And I'm not sure how JCMG, if they'll be considered in the federal, in the FQHC, if they'll be considered other clinics, because there's another allocation for other clinics, because they're not in that hospital clinic. Hospitals only got 2,000, Cap Region and St. Mary's. They got 2,000 to share. So I'm not sure how JCMG and like the community health center will figure into that, but we were told yesterday, I mean, this is their plan right now for this month, that we'll get 600 doses for all of Region F.
and President Biden is sending out 1 million doses to 6,500 pharmacies so they can start vaccinating people, and we can't get any vaccine. That's ludicrous.
And then we will continue to have those National Guard events, and we heard yesterday, or I guess when did I hear that? Friday afternoon, that they want to start scheduling some more of those mass vaccination events. So this is week 3. They were talking about scheduling another, they call them prime doses, the first doses, another prime dose event for weeks 4, 5, and 6, but I don't think they're going to have 4 done yet because I guess DHSS and SEMA are going to select the locations now. That won't be up to the RIT leader. So
Well,
that's the plan for this week.
we were so smart to have it indoors.
Oh, yes.
It worked perfectly, and I've sent out thank you notes, but Lincoln, Jeff City Parks and Rec, Chris White coordinated all this, and he was there at 4:30. I think
he
David
was there at
Boyles
3.
came at 4:45,
I was there at 6.
and so we need to,
You had great leadership, great planning. Good-
I think it was the presiding commissioner that,
It was well done.
it was really, really impressive, so, yeah,
And the parts
Christie.
that went wrong, nobody ever knew. That's the best part, right? Nobody
you-
ever knew that there were some parts that didn't go as planned. That's okay.
No, it was
That's how
one.
it's supposed to work.
It was wonderful. It was,
So, like I said, that's the plan that we're hearing this week for distribution. It does seem to keep changing, but just know that we're probably gonna have a lot of unhappy citizens because the amount of vaccines coming to our community is decreasing. You know, for a while, we were getting a flat of Pfizer, which was $9.75 a week, and now we might get 100 of Moderna, and we might not. So we can only give what we can give, and I think that I just need to start putting out on our website or our message when they call the health department, you know, we didn't get any vaccine last week and we didn't get any this week. So, I mean, we're doing second doses this week, but we can't give any prime doses because we don't have it.
But I think that's part of the message that needs to go out with this education person. Because people are complaining and bitching about coming in there and not being able to get it. It's
Yeah.
out of our control.
Mm-hmm.
So if they tell them to call MoDHSS then.
Yeah.
I mean, that's where I would direct.
or go find one of the 6,500 pharmacies that we give, which I don't think are in Missouri.
I mean, I look forward to when we have enough supply that you could just go to Walgreens and Hy-Vee or whatever, but right now it's just not there.
No.
I mean, they only get 76 or 75,000 doses in the whole state, and 37% of the population is in Kansas City and St. Louis, so that's where 37% of the vaccines are going.
And one
They're doing
week
it
in
by
Florida
population.
was doing 266,000 when they had the drive-throughs. And I'm like, now how the heck well, they got more people,
Yeah.
but 266,000, while we're getting 75,000, just really,
So are we expected to continue to give people shots outside of the county when we're just getting these minimal number of,
I guess we can talk
Vaccines?
about that. I know that there's other counties that are only giving it to people who live or work in that county, and we had not been doing that. These regional events, like
Yeah, I
the
know that's
National
been
Guard
mentioned.
events, those are different. They're
But if-
supposed to be for the whole
if we're
region.
being expected to give it to all the state employees, which they don't
No,
all come
I-
from Cole County,
Well, I'm gonna have to
and
tell them we
everybody else that
can't do that
works here.
anymore. Yeah,
then they need to give us more.
yeah. I emailed
We-
my
we
contact at
were-
the state yesterday and said.
we were
"We're not gonna be able to
getting
do that."
vaccine from like Cap Region and St. Mary's, and their patient region is like Montauk and Osage, and so you know we took patients, you know, from their counties that they cover. I left a UD in your mailbox that their presiding commissioner asked Susan Long why Osage County and were coming to Cole County and getting shots. So we can just
Yeah,
say,
I think the National Guard events are supposed to be regional events, but I think at the health department, we could make a policy if we wanted to only give it to people who live or work in Cole County, if you wanted us to.
For forever and ever, I've heard that the daytime population of Cole County well exceeds the pillow time population. So these folks come here And it would be ludicrous for us to say, it's okay to come here and work here and sit next to a
Right.
Cole County resident, but we're not going to see that you get a vaccine. So it makes no sense to me to exclude those people and actually, other counties may want to do this, but my sense would be we're better than that.
Yeah, and Boone County's doing that.
We're better than that.
We are.
And there was a study, I think it was in 2013 from WIC that said that, well, like WIC brought, $1 million into the Cole County grocery stores because people came to Cole County. Some of them get their WIC in Cole County because their local health departments don't have WIC every day, and then they spend their money in the WIC, in the Cole County grocery store, so. But no, right now, we've been giving.
I totally disagree with it. If we're gonna bringing these many people in, and the state's telling us we need to give their employees the vaccination, then they need to up the ante a little bit and give us a few more vaccinations. So I don't disagree with you. I'd like to, hey, whoever wants to come in and get it, take care of the people that need it and are older and have underlying conditions.
Yeah,
They
like
tell
me,
the state that we won't be able
Harry.
to do
I'm
the
not
state
in line.
employees
There's a lot of people way
So we
ahead of
don't
me.
have 'em.
I'm not worried about it, but just, we got all these people here, we can't get them shots. We have some of our own employees that have family members with underlying conditions, and we can't even get them in, so it's frustrating on that part of it, that they can take somebody and move them up in line, and we're playing by the rules, and it seems like they're not, so.
Because
well,
we
I-
don't have
I need to know that.
vaccine, it's a moot point anyway, so.
I agree with you there, Jeff. And I'm not saying we should advertise, come one, come all.
Yeah.
We've got unlimited. I'm not saying that at all. But if they work here, if they shop here, if they maybe even bring their kids here for all their medical, for us to say, you're not one of us. Go back to your home county. Especially with we have 2 hospitals that have 8 or 9 county service areas. So hopefully there's a sweet spot in there somewhere that we can hit.
Yeah, because the other counties don't have hospitals either, and
No.
you'd think with them being regional, they'd get a little bigger
No, the
handful of them.
Osage County did 262 vaccinations. So,
They're getting more this week. So.
yeah.
All right, anyway, I just wanted to talk to you that's what we're hearing this week.
You did an awesome job Friday, and Chris White,
Chris did awesome.
thank him.
I'll let in the stand up going great people, but there's the letter.
Oh, okay.
But did y'all need more help whenever you're putting
We
stuff up?
definitely need
Yes,
more.
we did.
We definitely need more
Hey.
setup and more tear down help, definitely. And even during the day, because there was, and I told, we talked about this with, at the time, we didn't exactly know what all the stations were gonna be and how it was gonna work out. And now that we know, we need, one person checking temperatures, one basically usher, fill in rows, we can have more of a schedule, because there was many of us that, barely got a break all day.
Nice.
And we tried to get the student nurses so they could go eat lunch, but having a schedule of people that relieve other people would be good, and making sure there's not people just sitting and watching.
And United Way provided box
Yeah,
lunches too, so we
and
need to
snacks
thank,
and water.
we need to thank them
Yeah.
too. So it was, we had support from everybody. It was just,
And, yeah,
But I think there was they needed some help at the end.
Mm-hmm.
I told you if y'all needed help or if Chris needed help to let me know, and God bless y'all for not telling me I had to be there at 5 a.m. Friday morning. When we were talking about it, I thought you meant it was gonna be at 5 p.m. and so I didn't know what I was volunteering for. But then if y'all need help, we're gonna have to ask, and I know there's some people that were sitting around, so we need to find out who's in charge of them and work with them, because, many hands will make light work for the few. I don't want them working you all to death, and this isn't even our event.
yes,
I mean,
it is. I know. It's advertised as someone else's event,
It's a
but
National Guard event, right? So we're administering the vaccinations and doing all the setting up and tearing down. So,
they direct traffic and they do data entry.
and so I think we need to have a little more hands-on there, help y'all out.
I agree.
this was an air unit from Whiteman Air Force Base.
They're switching.
I'm gonna go ride in a B2.
They're switching units. We're
yeah,
getting somebody else. They're moving that.
You
one
wanna go ride in a
back
B2?
to Region 8.
No, not really. If we're going to Mexico or somewhere for a week, I'd be all right, hadn't it? Will they drop me off?
Well, probably not.
All right, darn.
And it was really enjoyable too, just to see everybody. I saw the doctor that delivered me. He's going to be 97 this month, and I told him who I was, and he delivered me. He's like, "Well, I did a pretty good job, didn't I?" It was hilarious.
I wonder if
So
we
I
get
even took
some,
a picture with him to show my mom.
If we get
it was
a-
just I saw a lot of people. It was
get a Boy Scout troop or Sea Cadets or somebody to come help
I think
tear
that,
down.
I mean, yeah, I don't know. I don't know. We will work
If
on
Jeff
it.
will put in the paper that we're looking for
No,
some
don't say
youth
that.
groups, some youth groups
Yeah.
to help.
Well, and even like, I think I think if we
Sure.
reach out to some of the Rotary groups, because their mission is like polio vaccine and they're all about vaccine. So I think there's some key groups that I could reach out to. And SEMA did say they're trying to work with like AmeriCorps in that Vincent that helped in some of the, that they had the contract with to work in hospitals to see about vaccinators. So they're trying to get more help for these events too, because they realize that it takes a lot of volunteers, and if they want us to double up and have 2 events in each region each week, that's a lot of people. A lot of people.
Yeah, Lake Region was there because they're doing the one this Sunday when it's going to be 8 degrees.
I know,
And fortunately, they moved it indoors because it was going to be a state park. But he was very impressed. He's
And they're struggling with that because I guess they're thinking people might have to wait outside and it's going to be too cold. So they're trying to figure that out.
So that's some of the emergency services, like Sierra could take over more of the logistics things that would free Chris up to help you all more on other stuff?
Maybe.
Because that, I don't know, it just seems like that would be something that's down that alley.
Yeah.
And they should be handling that.
They were working together on the event.
We didn't have that many lined up outside. We
No,
brought
we
them
didn't.
in. We brought them in, and so we had 2 sergeants, and then Christy and myself, and then Dave Boyles was
Jenna.
there, and first thing we asked, what time is your appointment? And that way, because we had about 10, I think, who had no appointments. And then we checked their forms, if they had filled out their forms to make sure they signed everything. And if not, we took them to some tables. And then they took their temperature, JC Fire Department, and then some nurses as well. And then we had the lines roped off. They stood in line till people didn't stay outside. Now, I don't know what they'll do
no.
at the lake, but
And Chris said that he was timing the throughput, and at our busiest time, the throughput was 34 minutes. So that was most people were in and out quicker
Yeah.
than that. So I think that's pretty good.
I think that's damn
Especially
good.
when you have to sit there for 15 minutes after you get your
Yeah,
shot.
that's
And
what I
some
had.
people 30 if they have more adverse reactions, but we didn't have. I don't think there was very many. As I feel bad is I was over on the greeter side the whole time. I didn't get to watch a lot of the vaccination part because I
No.
didn't get over there.
It was good. You did a awesome job.
And I did send you guys that letter for the Midmo Regional Planning Grant.
Okay.
I sent it to the lady who's on the letter to
Okay.
Denver, Colorado. If there's somebody you want here locally to send that to, just forward that email. It's attached. You said something about David or something. You said something about David?
David Bach, yeah.
Yeah, so if you want to forward that to him, that's great. I did have one other thing. I emailed you guys yesterday on the siren that Sierra came to you guys about. We did have travelers. They did do an estimate on it, and basically they're sending us a check for $26,277. It's a replacement of that siren, less depreciation, and less our deductible. Since that siren is amongst other sirens, this is a sole source. So if you guys will direct us to go ahead and advertise for a sole source, then we'll get busy on getting a new siren put in, if that's the direction you want to go.
I do, but
Is there any reason not to do that? Though that location was strategic at one point, I guess. Is that still the case?
I don't think we've ever really gone back and looked at it, but yes, at the time it was strategically placed, and that was one of the ones that was ours. There's other ones in the county that are not owned by the county or not insured by the county, but this one is. So
Well,
I don't think there's any talk about ever moving locations for it or anything. so-
with that much, I would just replace it. 'Cause we had talked about having them go up there and look and see if it could be repaired. Well, I just soon put a new one up there. It'll probably get struck by lightning too, but
So you can go ahead and proceed with the next step in sole source?
Yes, if you could make a motion to go ahead and sole source that advertisement, that would speed up the little process a little bit.
That's in order. Motion to advertise sole source for the antenna replacement, tower replacement for the,
sorry. All in favor?
aye.
Aye.
Thank you. And the only other thing, I know I was asked to put some overtime or comp time on exempt employees. You still feel like we're under the declaration of health emergency at this point?
Yes.
And you guys will tell me when we're not? Okay. All right. I'll add it to those. You got anything?
Was that a commission vote to be under that, or was that a health
During
department
the-
directive?
The policy just says that the commission did
Okay.
declare it an health emergency event. Was it ever declared a health emergency event? I don't know. Was the coronavirus?
It was declared by the governor, and I know that we had to activate the EOC, so yes, it was, and we never
Withdrew it.
said it, but
Didn't withdraw it.
we didn't withdraw it.
It would appear to me that it's in effect until it's rescinded or terminated.
Yeah.
It would take action, so hopefully that will come someday.
Yeah. Okay. And we'll see through the vaccines, and then we'll see. I'll probably bring it back up if there's ever a time you want to. But rescind it.
Okay.
Okay.
Anything else? I've got two things. If looking back, if I'd known these boxes were gonna be, we probably wouldn't have done it, but anybody who hasn't received a box and still wants one, we have, I think, 100 here. We have 200 plus out at the health department, and I have 100 at the store. So just stop by and,
So I've never gotten one. So are they supposed to all be out?
I don't, no, not according to my letter carrier, and I don't know what they're doing. I've emailed the postmaster
So
so
I do
many.
know in the future, if we do this again, we do want to consult with the post office and probably
I don't,
check with them, because I talked with one of the delivery people, and he said there are other ways to do it that would
Yeah.
have been better for them and stuff, and to, not to pick on the post office
No.
on this matter, but
no, it's, anyway.
to send out 30,000 boxes like that.
Yeah, it was, that was,
And
but-
I mean, I agree, looking back, you know, we did it with good intentions, and it seemed like at the time, but we didn't know it was gonna be 6 months later before we get hand sanitizer. We should be
Yeah.
mailing people vaccination, if nothing else.
well, these are surgical grade masks, but if anybody,
I wasn't quite going there,
if
but
anybody needs them, health department, here, my store, Sierra has a bunch out there at emergency management, so.
somebody didn't like it enough that they went through the trouble to mail it back.
I
to
know,
us.
I know.
We have one left on our doorstep.
Yeah.
It's not so nice.
Yeah. And then the only
We're
other
not gonna make everybody happy, so.
only other thing I've got is we have a box out here for those wishing to retire an American flag. They may bring it up and put it in this box, and then we will give it to the American Legion to properly take,
Disposal.
dispose of them. So,
Two in there this morning.
good. So
We got
we do have a
one
box
too, so-
here out by the commission door, so,
So even if there's not a box here, they can bring it to the American Legion
yes.
and
Yeah.
other places like that to help get rid of them, because I know
Yep.
some people wonder what.
They do a nice ceremony. Yeah, it's, you don't, yes, it's done very well. It's very, so, but we do have the box here too.
I just want to, you guys were talking about those boxes. There is the invoice in the account payable for today to pay that. So if there's any issue, let me
Okay.
know. Otherwise, it's going to get paid.
What
Okay.
did you do about the extra fee that we had not agreed to, the extra?
We haven't gotten an invoice for it yet.
Yeah, I'll talk to Alex, 'cause I don't feel like we should. Okay. Anything else?
Move we adjourn, recess until 4:30.
Second.
All in favor?
Aye.
Aye. Good show.